Here we are. Hi, we're now in Psych 2, looking at therapy. We're going to go through part 1. And in part 1 in this, when we look at therapies for psychological disorders, we're going to look at any kind of treatment for emotional and behavior disorders that use psychological rather than biological. So biological will be medication, and cognitive or psychological will be the cognitive and therapies. And in the part 1, we're going to look at insight therapies. This will be like psychodynamic and humanistic and Gestalt. We're going to look at relationship therapies, couples, family, and group therapies. And then we're going to look at behavior therapies, behavior modification, which is operant conditioning, therapies based on classical condition, and we'll look at some therapies based on observational learning by Bandura. All right, so I hope you find this very useful. All of these theories and therapies, if you will, can work with varying kinds and not necessarily universal across all psychological disorders. And sometimes the therapies are used in conjunction with medication or biological treatments. All right, so let's get started with this one and see how we do. This is part 1. We'll start with insight therapies, and in particular, we'll start with psychodynamic therapies. Now, what are insight therapies? Well, these are approaches to psychotherapy based on the notion that psychological well-being depends on self-understanding. Now, understanding one's own thoughts, emotions, motivations, behavior, and coping mechanisms. The more we understand ourselves, the more we can understand how to improve or cope with difficulties within our own sense of self. Psychodynamic therapies in particular attempt to uncover childhood experiences that are thought to explain the person's current difficulties. Now remember, when we talked about Freud, one of the things that he was all about was the introduction of how the role of childhood affects future personality or future life experiences. So it makes sense in his therapies that the more you'd get a handle on what happened in your childhood, the more you can understand why these psychological disorders would emerge later in your life. So psychoanalysis was Freud's first psychodynamic theory. It uses free association, he used dream analysis, he used transference. Now, free association would be the technique used to explore the unconscious by having patients reveal whatever thoughts, feelings, or images would come to mind. No thinking about what's on your mind, just speak, just keep talking. The analysis piece together the free-flowing associations to explaining their meanings. It would help the patients gain insight into troubling thoughts and behaviors. Now, there would be an element that would be described as resistance, when a patient avoids revealing certain pains or embarrassing thoughts. Halting speech, like forgetting appointments or arriving late, would then prompt further exploration into what else is going on. With dream analysis, these would be areas of repressed emotional concerns expressed symbolically in dreams. Now, a lot of the research that's been going on in dreaming have not necessarily found that dreams have any purpose. In fact, some theories just say they are just random firings of the brain, and the dream is our brain's ability to sort of try to make sense of these random firings, that they really have no meaning. Transference. This is the emotional reaction that occurs during psychoanalysis, that the patient displays feelings and attitudes towards the analysis that were present in another significant relationship, often again in childhood. Freud believed that it would be an essential part of therapy. Patient can relive troubling experiences from the past with the analysis as a parent substitute. This would aid in resolving any of these hidden conflicts. And one of the elements about what was introduced was what's called brief psychodynamic therapy. Patients and therapists agreed beforehand about what issues to work on rather than waiting for them to emerge. The therapist assumed an active role. The emphasis emphasizes the present rather than the past as effective as other therapies. And that brief psychodynamic therapy is a bit of a departure from his psychoanalysis in that it didn't look so much at the past, looking at what's going on today. Now, if we carry on with insight therapies and we touch base on the humanistic therapy, that's Carl Rogers in the top right-hand corner there, it assumes that people have the ability and freedom to lead rational lives and make rational choices. And he introduced what he called the person-centered therapy. It's a non-directive, unlike Freud's perspective where it was, therapist directed. This is not directed by the therapist. It's a humanistic therapy. Therapist creates an accepting climate and shows empathy. They introduced what was called unconditional positive regard. It frees the client to be themselves, releasing their natural tendency towards self-actualization. You remember that humanistic psychology was really about following the sort of and guiding principle of the hierarchy of needs. Self-actualization was at the very pinnacle of the triangle. Psychological disorders result when a person's natural tendency towards self-actualization is blocked by oneself or others. The therapist emphasizes the client's concerns and emotions, reflective listening used in response, allowing the client to control the direction of the sessions. Rogers rejects all forms of therapy that cast the therapist as an expert who prescribes something to cure the problem. He's really more interested in allowing you to guide where you think it needs to go, and he acts as a sounding board. Now, a third form of insight therapy is what's called Gestalt. And the originator, Fritz Perls, emphasized the importance of clients fully experiencing in the present moment their feelings, their thoughts, and their actions. Client must then take responsibility for their own feelings. So the goal of Gestalt therapy is to help the client achieve a more integrated self and become more authentic and self-accepting. Learning to assume personal responsibility for their behavior rather than blaming society or blaming past experiences, their parents, or others was very beneficial in Gestalt therapy. Now, it's a directive therapy, which means any type of therapy in which the therapist takes an active role in determining the course of therapy and provides answers and suggests and makes suggestions for the patients. That's directive therapy. Getting in touch with your feelings is a major objective. Those in need of therapy carry around unfinished business. Now, they introduced a technique called the empty chair technique. And this is where the client will role play a past relationship where the empty chair represents this person in the past who they need to deal with or talk to or resolve a conflict with. Now the third class of therapy is relationship therapy, and it attempts to involve patients' interpersonal relationships or create new relationships to support patients' efforts to address psychological problems. Now, there's two forms we'll touch on here on this slide, and that will be traditional behavioral couple therapy, where this focuses on behavior change. You observe interactions to assess accuracy of complaints. So the therapist would have the couple there and would be observing the interaction between the couple and would then be assessing, one, what they're complaining about, and two, the accuracy of that complaint based on what they're observing, and to identify each spouse's strengths, what they bring to the table and how they could benefit from that. The attempt to modify behavioral problem behaviors and to enhance items helpful for the communication process. Now the second type is integrated behavioral couple therapy, and it emphasizes the emphasis here is both behavioral change and mutual acceptance. Problems arise from changeable behaviors in individuals and the personality traits of both partners. So it helps couples learn to accept and adjust to each other's personalities rather than trying to change them. Now the third type of relationship therapy that we'll look at is family therapy. And this involves the entire family. All people in the family, or in some cases parts of the family, would be a part of this treatment. The goal is to help family members reach agreement on changes that will help heal the family unit. So rather than looking at the individual as the problem, it accepts that everyone contributes to the overall issue of the family of which that individual client, if you will, the person with the identified problem, is a part of that family unit. So improving communication, creating understanding, and enhancing harmony within the group. Dynamics of the family unit, how members communicate, how they act toward and view each other is the paramount importance. Positive effect of treating disorders with clinical problems, well, sexual dysfunction, schizophrenia. When therapy is accompanied by medication, it can reduce relapse by reducing criticism, hostility, and emotional over-involvement. It can also be an effective treatment style for adolescent drug abuse. Another form of relationship therapy is what's known as group therapy. This can involve several clients, usually 7 to 10. They meet regularly with one or more therapists to resolve personal problems. They're less expensive than regular therapy, and it provides individuals with a sense of belonging, an opportunity to express feelings, opportunity to get feedback from other members, and chance to give and receive help and emotional support. Now, self-help groups, which fall within group therapy, are usually not led by a professional therapist. They provide people who share a common problem a chance to meet and get support. Most focus on a single problem, like drug abuse or depression. Alcoholics Anonymous, the oldest known, with about 1.5 million members worldwide. Derivatives include Gamblers Anonymous, Overeaters Anonymous, Narcotics Anonymous, Sex Addicts Anonymous. So group therapies are fairly common and fairly successful style. Now, another form of therapy are what known as behavior therapies. Behavior therapies, these are based on the idea that abnormal ideas are learned, not a sign of an underlying disorder. If I'm afraid to fly, then fear of flying is the problem. It applies the principle of operant and classical conditioning or observational learning. It eliminates inappropriate or maladaptive behavior and replaces them with more adaptive responses. It doesn't change the individual's personality structure or search for the origin of the problem. So if we were using behavior modification, this uses learning principles to eliminate inappropriate or maladaptive behaviors and replace them with more adaptive responses. Seeks to control the consequence of the behavior. If you look at the ABC, the antecedent is the A, things that precede the behavior, the B is the behavior, and the C is the consequence. Behavior modification wants to control the consequences. If I positively reinforce a new type of behavior, I increase the likelihood that you want to try to do that behavior again. So that's affecting the consequence to change the behavior. It doesn't change, extinction of undesirable behavior is accomplished by terminating or withdrawing the reinforcement. Any behavior that is a problem that keeps getting worse is being reinforced. If I can determine what is being reinforced, I can reduce that reinforcement and reduce that behavior. Seeks to reinforce desirable behavior to increase its frequency. This is best done in hospitals, prisons, and school classrooms. The reason why it's best done in those types of environments is that they're controlled environments, and you can control what's being reinforced a lot easier than you can if you're trying to address issues in the community and at home and at school. Another form of behavior modification are token economies, and these are rewards that you would give for appropriate behaviors with tokens, poker chips, coupons, play money, stars, stickers. We see this used in schools an awful lot, that if you read 3 books in a week, you get 3 stars, and the more stars you collect, you can get a reward. And what they're trying to promote is reading. So tokens are later exchanged for some goods or for privileges, weekend passes, candy, gum, TV time, etc. like that. And undesirable behavior can be fined for a certain number of tokens. And then we've also used a technique called timeout, which is used to eliminate undesirable behavior by withdrawing all the reinforcers for a period of time. If they do undesirable behavior, they will be removed from the situation for a period of time, and in a place containing no reinforcers, no toys, no friends, no television, no books or anything, the undesirable behavior will stop if it's no longer reinforced. Now, I wouldn't recommend, certainly with children, to use a timeout or token economies unless you get some professional support on how to utilize them correctly so that you're doing the right thing and doing the right changes and not trying to do it without the support and the awareness of how to do it correctly. Now, in along the lines of behavior therapies are other techniques for other sorts of conditions. Now, a systematic desensitization is used for some phobias, used to treat fears by training clients in deep muscle relaxation. Then they confront a hierarchy of anxiety-producing situations, real or imagined. Repeat until they remain relaxed, even in the most feared situation. A highly successful treatment for eliminating fears and phobias in short periods of time. So if I teach you how to do muscle relaxing technique, and I give you that, and you practice it, and you become pretty competent at it, then we show, if you have a fear of spiders, we'd show you some black and white, unrealistic pictures of spiders, and if you start getting anxious, you employ your deep muscle relaxation technique, and as you become more competent and manage that, we get to more real, and eventually we put a tarantula on your hand and you don't have the reaction you had. That's one strategy that's used for phobias. Flooding is another. This is used to treat phobias by exposing the client to the feared object or event for an extended period of time until the anxiety decreases. A client with a fear of heights may stand on the roof of a building until anxiety subsides. Sessions do not end until the patients are markedly less afraid. Using flooding in real life can work faster. It can be done up in 6 sessions, but you certainly need to keep a close eye that you're just not producing more anxiety as you go through. Now, the last element we'll look at in behavior therapies is looking at exposure and response prevention, aversion therapy, and participant modeling. Now, exposure and response prevention, a behavior therapy that exposes clients with obsessive compulsive disorder to stimuli that trigger the obsession and compulsive rituals, while clients resist performing the compulsive rituals for progressively longer periods of time. So if I have a fear, of germs, and we put germs on my hand and I normally go and wash them right away, the idea with this is to delay that time when I go to wash from, say, 1 second to 5 seconds, and then each time we expose myself to the germs over time, we would extend that from 5 seconds to 10 to 15 to 30 to a minute, and that would start to break the habit, as it were. Expose patients with obsessive compulsive disorder to stimuli to trigger the obsession and compulsive rituals, like touching a doorknob, piece of unwashed fruit, a garbage bin. Patient resists performing the compulsive ritual for progressively longer periods of time, so they don't wash their hands or bathe, etc. The therapist identifies trigger thoughts, objects, and situations. Typically 10 treatment sessions over a 3 to 7 week period makes improvements in 60 to 70% of patients. Now, the aversion therapy is an aversive stimulus is paired with a harmful or socially undesirable behavior until the behavior becomes associated with pain or discomfort. Negative behavior is paired with a painful, sickening, otherwise adverse stimulus until the behavior becomes associated with that pain and discomfort. Electric shock or metrix, causing nausea and vomiting. The antabuse is a medication that some people will use to stop a behavior. Antabuse reacts violently with alcohol, causing the person to retch and vomit until the stomach is empty. Painting fingernails in a bitter tasting coating stops nail chewing. So that's an aversion therapy. And then the last one is participant modeling. An appropriate response to a feared stimulus is modeled in graduated steps. The client attempts to imitate the model step by step and is encouraged and supported by the therapist. So there are lots, and we've only touched on, at this point, the psychoanalysis, insight therapies, the relationship therapies, and behavior therapies in part 1. What we'll look at coming up in part 2 will be cognitive therapies, biomedical therapies, and therapies and therapists. All right, so far we're doing really well. Keep up the good